I've enjoyed collaborating with Dr. Daniel Kirages from the University of Southern California, who has been instrumental in helping organize our 3-episode Chronic Prostatitis, Chronic Pelvic Pain Syndrome series. We started with an episode on the research and science aspect of the condition, which was followed by the urologist perspective last week. Today we'll put a bow on it with an episode on the physical therapy intervention side. So listen in. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pohlman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Our guest on the Prostate Health Podcast is making a second appearance on the show. Back in episode 46, he did an excellent job in discussing how physical therapy can be instrumental in helping regain urine control after prostatectomy for prostate cancer. Since then, he has been working behind the scenes in helping organize our 3-part series for chronic prostatitis, chronic pelvic pain syndrome. For those of you who don't know Dr. Daniel Kirages, he is an associate professor of clinical physical therapy at the University of Southern California. In his clinical practice, he attends to a diversified patient load, including various pelvic health disorders. You can also find him lecturing at a variety of academic institutions and healthcare facilities nationally and internationally. He was the first doctor of physical therapy to join us on the Prostate Health Podcast. Dr. Kirages, welcome to the Prostate Health Podcast.
Thank you very much. I'm pleased to be here. Thank you, Dr. Pohlman. It's wonderful to be back on your very informative podcast.
Well, we do appreciate you coming back to join us again, and I'm sure our listeners will as well. So now, in evaluating men with symptoms of chronic prostatitis or chronic pelvic pain syndrome, one of my jobs as a urologist is helping rule out any sinister pathology within the prostate itself. But really, when it comes to the management of these men with chronic pelvic pain, I think we really can lean heavily on our colleagues in physical therapy who can really be instrumental in helping these individuals. So Dr. Kirages, can you speak to the pelvic muscular contribution as a source for symptoms of this condition?
Yes. So historically, it's been thought that issues with the muscles within the pelvis will manifest solely with voiding concerns. But we never want to underestimate the power of myofascial pain. And this would be pain associated with the musculature. Now, there is peer-reviewed literature which points to this as being something to consider, because in those who have been diagnosed with pelvic pain, their pelvic floor muscle, which is the muscle at the base of their pelvic area, is tender in 51% of those people diagnosed, and only in 7% of those who are what we would say more the control or without symptoms. Other literature shows that the actual pain site is reproduced with touching of those pelvic floor muscles, which makes it seem like those muscles might be related to the symptoms that the patient is experiencing. Other things would be looking at using ultrasound that you can see. Basically, you can visualize the pelvic muscle. And for those patients who've been diagnosed with chronic pelvic pain syndrome, we notice that their pelvic floor muscle movement is very little compared to those who do not have the diagnosis of pelvic pain. So that might indicate that there's a issue happening with the muscle there. And then when there's intervention, which is specifically targeted to the pelvic floor muscles, there's some symptom reduction in 79% of those men who have been diagnosed with pelvic pain. Now, that's not saying that those symptoms are reduced in one shot and they're good for life, but there is a change in a positive direction in the symptoms of those men who are having interventions directly related to their muscle. So if we take all that information, we could logically think that there is some muscle contribution to those who are experiencing pain in this area.
Well, that was a very excellent response there. We appreciate that. And now, when you mentioned the pelvic floor muscles, for our listeners, what are the pelvic floor muscles?
Well, they're a group of muscles and connective tissue which spans from the front of the pelvis, that area is called the pubic bone or the pubic symphysis, all the way to the tailbone in the back. So it's like the bottom of a bowl. The pelvic muscles are the bottom of that ring of bone. And they have three main functions. Number one is supportive. So if you think of a bowl, how things might be inside of the bowl, which would be the pelvic organs. It'd be the bladder, it'd be the rectum, and in the those with female anatomy, it would be the uterus in between and everything that's stacked up on top of those. So this pelvic floor muscle has to support those. Then there's the function of the pelvic floor as a sphincter, which is basically keeping the doors closed of the bowel and bladder, making sure that we are continent or maintaining our stool where it's supposed to be and our urine where it's supposed to be until we decide it's time to relax and empty. The third role of the pelvic floor muscles is a sexual function. So in those with male anatomy, ejaculation will occur where, a sexual climax, these pelvic floor muscles will contract and push out that ejaculate, as well as during sexual arousal when a male will have an erection, these pelvic floor muscles will tighten up a little bit purposefully to also block some of the blood vessels to try and maintain the blood within that erect penis.
Now, what are some of the symptoms that you commonly see of this, muscle-related chronic prostatitis, chronic pelvic pain syndrome?
Well, symptoms can be described as sometimes it feels like there's a knot between my legs, or I feel like I'm sitting upon a golf ball. The tip of my penis might burn. I have pain after ejaculation, and that pain would be, underneath where the scrotal area is, or that area between the anus and the scrotum. It's called the perineum region. Sometimes there's burning sensations that they feel within their urethra, within their anus. So those are some of the descriptions. The symptoms can be a wide variety of ranges, meaning they could be very severe or they could just be minor but annoying. And that's where there's a broad perspective of those who are experiencing pelvic pain and in just the amount of pain that they might be having. There's also a variety of patterns. Sometimes the pattern is in the anus, as we mentioned, the penis or that perineum region, but it could also be suprapubic, which is like just above the pubic bone, like where like someone's belt buckle might be. It could be on the inner thighs. It could be, in the low back area a little bit. So there's a variety of places, but primarily when we say pelvic pain, typically it's going to be somewhere within that pelvic region in the undercarriage, so to speak. And it could be acute, like it can come on just out of the blue strongly, and with some intervention, it can dissipate, or it could be chronic and more persistent.
And you kind of mentioned where it can kind of come on out of the blue. Do you see, for some patients that you speak with, do they report any kind of triggers that set this off, or not typically?
They can. Sometimes it could be from ejaculation. I had some sexual experience that they may have had, which then triggers some of these symptoms. They could also relate it to just insidious onset, which is, I don't know where it came from. I just started having some discomfort in my anus. And maybe it was a large bowel movement that they had. But I think that those particular incidences that they might describe wasn't the main reason why it happened. It's kind of like that analogy of there's something on the verge of happening, and then there is some episode that triggers that. And when it does trigger, there can be other symptoms that they feel other than pain. It could be the fact that they may have urinary frequency. They might have a weak stream of urination. So dribbling afterwards, like it doesn't just stop when their bladder is empty. There could be then that would be more urinary. But there's also more colorectal or defecatory issues. For example, fragmented stools, very thin stools, the fullness in a rectum. They don't feel like they complete a bowel movement. And all these symptoms that they're describing gives you the sense, right, of something's not relaxing well. The door's not opening all the way to allow voiding to occur, whether it's, urination or defecation. And, the sitting is often something which can aggravate the symptoms. Sometimes physical activity can aggravate the symptoms, but in some people, physical activity is actually helpful. Emotional stress is a large one that sometimes will be present. You mentioned a trigger. There's been many patients that I've seen who have had some trigger, like we mentioned about like a bowel movement or ejaculation or something, but within their life at that time, there was some emotional stress that was occurring. And, those are definitely things to consider.
As urologists who increasingly rely on physical therapy in the management of symptoms of the condition, before getting connected with a physical therapist, that they know can manage these patients, I think many may initially have a difficult time in finding a physical therapist who knows how to treat these patients. Why do you see this sometimes being difficult in finding a physical therapist to manage these men?
Well, one of the main reasons is that there's minimal exposure to pelvic pain in physical therapy schools. Although many programs are including it more within their curriculums. USC, where I'm on faculty, we have more than most, but that's also because we see these patients within our USC physical therapy clinics, as well as they're being studied within our research labs headed by Dr. Jason Kutch, who was also included in this podcast series. Another reason is that it's such an intimate area of the body, and many clinicians may be uncomfortable with working in the genital region. So you see, in physical therapy, postgraduate specialized training is voluntary. So if someone has an interest to work with these patients experiencing pelvic pain, then they will seek that training, which can be costly. However, great news is that our American Physical Therapy Association, which is our professional organization, now has an Academy of Pelvic Health Physical Therapy, which is where education and training is provided for all forms of pelvic health concerns. So it used to be the section on women's health, which was limiting to men with pelvic concerns. But now with the name change and the reorganization into this Academy of Pelvic Health Physical Therapy, it's now fully inclusive. And this is a great move and will open the doors to improved care overall.
Now, what can an individual expect in the initial evaluation process when going to see a physical therapist for the condition?
The initial evaluation will be to get a sense of the symptoms that someone's experiencing, the behavior of them, the length of time, specific location, the intensity, if any bowel or bladder challenges are present as well, those types of questions. Also, one of the most important pieces of information is the story which surrounds the onset of the symptoms. So sometimes a time of emotional stress, as we mentioned earlier, can trigger some of these more persistent pain issues. The pelvis is a place where people can hold their stress, so to speak. So it's important to ask about stressors and how they manage them. For example, some people maybe grind their teeth at night. Some get acid reflux. Others may hold their tension in their pelvic floor area, which means that it's more than just the local muscles. It includes our central nervous system, our brain. And other parts of the initial evaluation will be the objective exam, and this will include palpating or touching the pelvic floor muscles externally and potentially internally, feeling for tender areas or spots of muscle restrictions, as we would call them. The ability for someone to contract and relax their pelvic floor muscle will be highly important as well to determine if they're aware of pelvic floor muscle control.
Now, lastly, what can a man expect with physical therapy treatment for muscle-related chronic pelvic pain syndrome?
Intervention will be multifactorial. Focus will be on pelvic floor muscle control for learning how to properly contract, but maybe more importantly, how to relax after that contraction. The muscles need to be trained to quiet back to their normal baseline post-contraction, like after ejaculation, for example. There will be some soft tissue mobilization, or can we say massage of the muscles internally if needed, as well as externally to get them to quiet and tolerate healthy pressure, which means that we're desensitizing the muscles and tissues in the area to accept pressure, as in sitting. For example, sitting can be something which is one of the most common aggravating factors. Someone sits for 10 minutes and now they have this burning which starts in their pelvic area. So we want those tissues and their communication with the brain to recognize that it's a safe activity, like sitting is safe. So when the nervous system is amped up, it'll sensitize the area, and the brain may decide it's important to have pain when feeling pressure in this particular area. But so our goal is to help the patient reduce this sensitivity. So additional interventions will be like diaphragmatic breathing, which is to quiet the nervous system and lower the threshold of the pain response, along with some of the other interventions mentioned.
Well, this has really been informative, very helpful information for our listeners today regarding chronic prostatitis, chronic pelvic pain syndrome. As we're nearing the end of the show today, Dr. Kirages will be sticking around after the show to answer just a few bonus questions for the upcoming Prostate Health Academy, including some tips on maybe how to find a physical therapist who specializes in this area. Now, for those that are interested, can just go ahead and sign up at the link at prostatehealthacademy.com. So, Dr. Kirages, any final thoughts today for our listeners?
Just don't suffer in silence. If you're experiencing symptoms which seem pelvic pain related, be sure to find a practitioner who may be familiar with pelvic pain and start that journey towards recovery. You're not on an island by yourself. Many people are experiencing pelvic pain. I think in male population, there's up to 12 to 15% of men are experiencing these symptoms. And in the female population, it's greater than that. It's a quarter of the females are experiencing pelvic pain related. So because of this, there's more and more money being put into research to study pelvic pain. So we as a healthcare community can have a better understanding and head towards that road of recovery.
Well, thank you so much again, and really for all your hard work in helping organize and make this 3-part series on chronic pelvic pain syndrome really a reality. It's been a pleasure collaborating, and I know our listeners have really gained valuable information, which will help empower men and their loved ones. So thanks again.
My pleasure. Thank you for the opportunity.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/Prostate Health Podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.